So for the next 20 minutes, Jill and I will be sharing some reflections from a recent policy event that was held by Ni3 on the 8th of March of this year, to coincide with International Women's Day. The policy event was funded by the QR Strategic Priorities Fund and was a really important opportunity to share our research findings and the new game that we've created with professionals and practitioners with a strategic responsibility and interest in preventing violence against women. As well as sharing our latest research findings and the groundbreaking video game, it was really a chance to demonstrate impact and get interested professionals round the table to think about how we can enact positive change in this area. So it's absolutely crucial, and it represented a significant moment after 3.5 years worth of work to start sharing our findings, but also more importantly, start initiating key conversations with delegates and thinking about how we can all be on the same page moving forwards. So the research included both a qualitative study that we undertook with both survivors and perpetrators of intimate partner violence in the UK, and a meta-synthesis, so a global study bringing together all the latest research which looks at Black, Asian and minority ethnic women's experiences of barriers around help seeking, and we'll talk a little bit about that later on. So there was lots of research that we had undertaken in the last 3.5 years, and the qualitative aspect of the research fed into this groundbreaking game, Danielle. And that was also a key moment, you know, sharing that with our delegates. In terms of how we created this policy forum, it was very much all hands on deck. There was a lot of work that we had to do and a lot of pre-planning that went on behind the scenes. We were very fortunate in enlisting the help of two very dedicated PhD students, Lara and Victoria, who massively helped with sending out invites, doing social media and preparing delegate packs, doing all of the crucial admin and comms, as well as our existing administration and communications team. So it's really important to have lots of people on standby to assist because it was a massive undertaking. And Jill put in a mammoth amount of work, from everything from engaging in social media to writing personalized emails to our keynote speakers. And it's really crucial that you don't just send out a blanket email to your speakers, that you actually take time to really tailor it to their agenda, their needs, and really articulate why your research is important, why it should be important, why they need to be part of the conversation, and find a hook really. So for example, Jill emailed both Nicole Jacobs, the Commissioner of Domestic Abuse, and MP Jess Phillips, and hooked our research onto the development of the Domestic Abuse Bill. So that was really important, you know, harnessing this and showing it actually, not only have we got this groundbreaking body of work, it's really politically relevant right now. And now is absolutely the time for us to all be sat around the table, talking with other people about how we can put this plan of action in place, really. So that was really crucial. And it was important that the emails were short enough, you know, because we're contacting very busy people. So using quite simple language and being very clear about what it is that the day is going to be and what it is that we want, really. She also did a lot of work looking, well, Twitter, communicating with people online, finding our champions. So we're very fortunate to get the help of Rachel Williams, who's a survivor of intimate partner violence, and she really became a key champion in promoting the policy forum and actually getting us in touch with other speakers and delegates. Jill will talk a little bit later about the programming and how much care we needed to ensure that it was a very focused program of activities. But the keynote speakers are really crucial. So we did spend a lot of time thinking about who we wanted to invite, and also not just for the policy forum, but conversations moving beyond the forum as well. We also commissioned experts by experience, so intimate partner violence survivors, to create emotionally resonant content. And so this included artwork by the photographer Susie Lark, and also a short film that was made especially for this forum by the filmmaker Ella Caton. And she used some of the words, some of the stories from our survivor narratives from the qualitative study to inform the film itself. And the result was extremely powerful and thought-provoking, just to have these images, the soundtrack, the film, frame the forum was crucial, and it really brought home the messages that our research was communicating, almost in a kind of shorthand, really, to get our delegates on the same page, and to ensure that actually we were reminded of the people behind the data. This isn't just an abstract exercise, you know, we're talking about lived experiences, real people who've undergone massive trauma, but also showing massive resilience in coming through the other side of that journey. So it's creating a heartfelt connection through the data, and that was immensely powerful. And I'll just end what I have to say really by just saying, don't downplay your own connection to your research. You know, it's really important that we're upfront about why we do this stuff, and it is because we care, because we want to see change enacted, and that's a real strength that helps bring other people who are also proactive about change around the table. And I'll just pass on to Jill now.
Thanks, Louis. As you can see from the last slide, the incredibly powerful artwork that Susie did for us, and that, as Louis has begun to say, was some of the reasons that we had to think about how do we make what would normally be an offline conference where we'd be able to see each other face to face, how do we make an online forum as powerful? And that's a real challenge. And so by way of the video and the artwork, that was a wonderful way to invite delegates into what would normally be a reception area of a conference, but it was an online reception area, which enabled delegates to come together to really get a sense and a flavour, as Louis was saying, of survivor experiences. What is the realness behind our research, behind the statistics, behind the themes? These are the women, and this is their experiences. And it allowed delegates online to put statements in, to share experiences, which basically from the get-go means that we're beginning to form a community online, which is incredibly important. The other thing we did to try and replicate refreshments that one would normally receive at a conference was self-care packages. So as with part of the funding money, we were able to send out gift packages that arrived 1-2 days before our forum. Beautiful little boxes of tea, coffee, biscuits, and everybody got their own individual Ni3 mug. And we talked about it in terms of what I like to call wrapping attendees in an invisible hug. It was an effort to say, look, we know this conference is going to be challenging and difficult because the themes and the findings are emotional and may trigger. But actually, what we want you to do is to, at any time, take a break, have a cup of tea or have a cup of coffee, and know that your other delegates and colleagues are going to be doing exactly the same. And that was really appreciated by the audience. They made reference to that throughout, just to say thank you. So the other online challenge is obviously when we do this offline, we would give personal trigger warnings, empower delegates to self-care, but we can also physically connect to people. So we may be able to witness when somebody is either disconnecting or is upset. Now, that's really difficult to do online. So all we could do about that was just to share our experiences and knowledge of knowing that that might happen. Yeah, and that that would be okay, and that people just needed to care for themselves and come back at the first available opportunity. Another challenge was looking at the technology that was needed, because we had outside speakers, obviously from the Home Office, from members of Parliament, and other parts of the country. And so what was really important was to work with our IT team beforehand. They needed to contact the outside speakers to make sure that they'd done a run through to test internet connection, etc. And also to let them know when they needed to come on into the program in order to be there on time to sort it. So the practice, practice, practice note at the top of that slide probably needs about another 7 practices, because we really needed to hone down what it was we were doing, and more importantly, who was actually doing it. Another instance in terms of trying to think ahead in terms of worst case scenario was, as a team, what we thought about in case somebody's connection went down and nothing had been pre-recorded, that we talked about having emergency questions prepared either for the presenters or for the audience to maybe elicit more information or elicit delegates' own experiences. Thankfully, we didn't need that. But if you're thinking of doing something similar, you need to have that in your back pocket just in case something goes wrong. What we also put into the day was breakout rooms, because once we had disseminated all the research from all the presenters, we wanted to give opportunity to the immense expertise in the room for them to come together and debate and discuss not only the findings, but more importantly, the recommendations, and to think about what pledges they would make for change. They themselves were a logistic nightmare, but IT were phenomenal. We needed a great deal of support from the team. Each breakout room had 2 co-chairs and a minute taker, and I provided minute takers with a template. So each breakout room was actually capturing and recording the same sorts of themes. All chairs were given a script to ensure experiences were similar across the board, and it helped connect the audience with one another. It enabled their specialist knowledge to be appreciated, and we were able to take lists of their pledges. In terms of surprises, there was one big one, probably. We had anticipated defensiveness from professionals, especially social workers and police, because of the challenges represented by our findings. No professional body came out well, but systematically throughout, social workers and police were mentioned regularly. However, we were pleasantly surprised by how positive and enthusiastic our attendees were. What I had done to sort of preempt any defensiveness was to have online meetings with police and social services and health beforehand, just to tread carefully in terms of what our findings and recommendations were saying, and to warn them that they as a professional body did not come out well. It wasn't really much of a surprise to them, and they were very eager to learn new research, hungry to know what we had to say, and were nicely proactive when it came to discussing next steps. So it was important that our presentations resonated with professionals' experiences, and delegates were beautifully honest in what they had to say. They felt our passion, and likewise, we felt theirs. In terms of a learning curve, 2 things probably. We were struck by some of the advice from the university, which was don't go online for long. People won't be able to concentrate. People will leave. You need to do 2 hours, 3 hours max. I would say that from our experience, that wasn't true. I think if you are providing something that is engaging, powerful, emotional, and links to their experiences as either a survivor or as a professional trying to work within your research area, you will hold them, because there's such a lack of opportunity, particularly for multi-agency audiences, to actually learn from one another and listen to one another and come together to think about a way forward. So I would say, don't always heed by that advice. Trust your gut, and if it's an exciting conference, then people will stay. The other learning curve was our breakout sessions weren't long enough. People wanted to talk, and people wanted to engage, and realistically and unfortunately, we'd only just managed to get that going when unfortunately we had to pull people back. So don't just think of a research conference as your opportunity to talk to delegates. Ensure that you know who your audience is and that you give them opportunity to give of their worthwhile experience. So the research, it was important to give a clear vision and focus. When you're looking at your program and trying to think about how you're going to develop it, start with your aims and objectives and think about who your audience is, and importantly, what do they already know? Yeah, audiences don't want to come and be patronised by researchers. It's a bit like teaching grandma to suck eggs. So it needs to be clear and focused. You need to be passionate, as Louis has already said, and honest about the findings, and allow delegates opportunity to question, debate, and understand your recommendations. And importantly, to give of a pledge. Letting people just leave a conference means that you've got no idea really of what's going to happen next. And we were really focused after 3.5 years that we really wanted an impact. And so we made sure that there was time within the program, not only to look at our qualitative research, but also to look at what Louis has talked about in terms of our systematic review, to really enable professionals to realise that for all women, it's really difficult to leave domestic abuse. And we smashed those myths through our research. But how much more difficult it is for women of Black, Asian, minority, ethnic groups to be able to leave. And we talked with them openly, honestly, about the impact of patriarchy and, importantly, racism, which goes through every institution that women try to seek help from. And therefore, using personal stories too, and some of the quotes within that wealth of research to really get the message across that what we're doing currently is not good enough and really, really has to change. Key messages through another researcher. Louis has pertained to this really in that I was really careful in thinking about what our research did, but maybe where some of the gaps were. And what we'd got within our qualitative research was the role of children within domestic abuse, not as witnesses, but thoroughly involved within it, either trying to stop it or being hurt through it. But the stories of the children came through the voice of the mothers. And I think there was a tension there and a slight weakness to it. So I engaged with Dr. Emma Katz, who has just done some of the most fabulous research interviewing children who have experienced domestic abuse. So from the mouths of children, Emma was able to give very powerful presentation to ensure that both our research and her research helped professionals really understand how children are victims, not witnesses of domestic abuse. So her research just slid beautifully into what we were saying as well. And so that enabled us to initiate and continue the conversation. So lastly, just a slide to look at the impact of such a forum, an impact of being able to talk with key delegates, whether they're professionals or others, about your research. And some of the impact actually began before the forum began. And as Louis was saying, I did a lot of work with others in terms of initiating conversations, not only with the Commissioner for Domestic Abuse, the Shadow Minister for Domestic Abuse, and others, the Home Office, the DFE. As soon as we started talking about our research, one of the things I also did was give them a link to the game so that they could actually download it and begin to understand some of what that looked like, which again really excited delegates because of the innovation behind it, that this isn't just research, it's research that can have an impact because we have an intervention. And it was when I was talking with Nicole Jacobs, Domestic Abuse Commissioner, she said to me that that for her was the hook. That was why she wanted to come and talk with us, was because I'd said, this isn't just research. This is about changing the lives of women and girls and being passionate about what you do. And through them, I was invited as an expert on a thematic subgroup for the domestic abuse bill, which was about children and young people. We, along with other members of the team, have given evidence for the Violence Against Women and Girls strategy, and I've had discussions with some very enthusiastic personnel from the DFE, the Department for Education, looking at our psychosocial survey and looking at the prevalence of girls experiencing abuse inside and outside of the family home, but also asking those important questions. So what are we saying needs to happen, and having that open conversation, all before we actually got to the forum. During the forum, it was really important to make sure that we had robust evaluation, not just at the point of delegates leaving with their pledge, but that we followed it up. And I think some of the learning would be that we could have done that better. We could have perhaps followed up at 2 stages, not just one. And so if we were to do it again, we would. That we had a huge amount of available resources so that when people left the policy forum, they were reminded of who we were, because they had a number of different web site links that would lead them to all sorts of innovative pilot schemes up and down the country that had received pockets of government money to either run slightly different types of perpetrator programs, health programs, survivor programs, so that everybody in the room could actually look at what was the next stage, what was currently working and what wasn't. Where we are next, it continues. The last bit is that we're now in schools completing the computer game trials. We will need to do something similar that we did in March, because we will have analysed the data, which will hopefully show that gameplay changes attitudes and behaviours for young people and enable them to recognise what is needed in a healthy relationship, and importantly, what isn't. And because of the work and because of the networking that happened within the online conference, we have now got working on 2 bids, one being submitted, one yet to be submitted, with an organisation called Safety in Music, and one for Kirklees Council, which is provision to address abusive behaviour by male perpetrators. The Safety in Music is to provide safe spaces in nightclubs, bars, etc., for women and girls. So as you can see, it's had an enormous amount of impact. It was developed in a really short time, but having a team of passionate researchers, knowledgeable researchers who can sit and network and talk with professionals, then I think what we're beginning to show is that change can really happen.